Recording in progress.
Hi, Dr. Lin. Are you ready?
Yes, I'm online now.
Okay, not yet. Let me go ahead and have Donna comes up, and then we do the intro, and then go from there, okay?
Okay, good.
Hey everyone, thank you for joining us for today's webinar. My name is Donna Chow and I'm your host and your moderator for today's eLotus class. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is From Theory to Clinic, Patient Analysis 1, presented by Dr. Hsin Lin. The goal of this class is to simulate the experience of shadowing a teacher right next to them in the clinic, seeing how they see patients and ask questions, and we do so through the distance telemedicine model. You will have the opportunity to explore Dr. Lin's strategic thought process as he delivers a diagnosis and treatment plan remotely so that you can do it in your practice as well. We will provide the chief complaint, a brief case history and background of the patient before he analyzes the case, and he will ask questions to better understand the patient's symptoms. Following the case analysis and prescribed treatment plan of herbs and acupuncture points, you, as a participant, may ask questions about the diagnosis, etiology, and rationale for herb selection. This is a golden opportunity to learn why certain herbs were ruled out for treatment and why certain prescriptions were made. Before we begin, I'd like to go over a few items to familiarize you with our webinars and how they work. Today's webinar will be from 9 a.m. to 11 p.m., 9 a.m. to 11 a.m. Pacific time, and we will have one break. The first half will be patient examination and questions, and the second half will be formula and point discussion. To use the webinar chat room, we do ask that you set your chat preference to everyone, since this is a very interactive class and we want everyone to be part of the conversation. So do this now, set your chat preference to everyone. And if you want to ask a question to Dr. Lin, please post your question in the Q&A box. And if time allows, and he will go ahead and respond to them for you. And finally, the quiz and the video replay, you will be notified by email once the quiz and the video replay are ready. All right, so our speaker today is Dr. Hsin Lin, who earned his Doctor of Medicine from China Medical University in Taiwan, and worked as an associate professor in the Department of Traditional Chinese Medicine after completing a bachelor's degree at the same institution. He taught for 12 years at the university and has been in private practice for over 20 years, specializing in difficult to treat conditions. He's one of the most knowledgeable and most patient speaker that we have here, and this is actually his first eLotus webinar in English. So now let's go ahead and begin class and welcome Dr. Lin.
Good morning, everyone. Can you hear me all right? Please type yes into the chat room. I'm going to be the teacher's assistant today because this is Dr. Lin's first class in English, and we've held this class 3 times in Chinese, and it was very smooth. We all learned a lot. So the flow today is going to be him interviewing the patient for the first hour. I will be helping with the pulse diagnosis and the abdominal palpation portion. And then also on the second session, from 10 to 11, where he will be explaining about the case. If there are any questions that he would like to elaborate a little bit more on, I will also help him do that as well. So we can get started today with the case analysis with our patient Diana. So welcome. Can you have a seat over there at the table? Thank you. her here. Yeah, look into the camera. There's gonna be him and Dr. Lin and her.
Okay,
Yes.
go ahead.
Oh, okay. Hi everybody. Tina, Diana, and everybody. I'm very happy to be here. I think today we will experience clinical case together. I would like to collect the message, the information from Diana, and I will ask you some question and try to identify every pieces of the information. And I will ask Tina to do the pulse taking and chest and belly palpation and tapping to help us to collect the information from there. Then I will think about your question and your issue and give you some health education. And then I will give you some prescription, but I will tell Tina how to prepare it for you. And the next part of this course, I will discuss with other audience about your condition. So is that okay?
Okay.
Okay, good. So we save our time. We just begin. Okay. So can you just simply describe your issue?
Well, at first I didn't feel anything, and then to like 2 years later, I just felt like very tired and headaches, and then abnormal period. So I went to check with my primary doctor, and then they ran a lot of tests. They just told me they found a pituitary gland tumor on the brain that has to do with the hormones. So they did some blood work. They told me that my hormones level is super high, and then they put me on the medication. So I've been taking the medication for a whole year, and finally, 2 months ago, I did a lab work, and the hormones level went down for a normal level, and I still taking the medication.
Mm-hmm. Okay. So after you take the medicine, I think your hormone, the level of your hormone, the concentrate of your hormone become decreased, right?
Yes.
And how about the tumor in your pituitary gland?
I did the MRI beginning of this year. They said it still has same as last year, like very small mass, but then there's nothing they can do because it's too small. They just told me to leave it alone and just continue with the medicine.
Okay. So before today's course, Tina transfer your physical examination test result to me, and I see all the report. It's very weird. First one, your blood test is normal. Second, you do the brain MRI on I think on March this year, right?
Yes.
Yeah, and the result about the MRI is normal. There's no any tumor in your pituitary gland. Maybe you can check your test again. I mean, you can check the report again because the report said there's no tumor there.
Right.
Okay.
They still said that there's a small mass, but then they just told me to continue the medicine
Okay.
to control the hormone.
Yeah. I think maybe it's like makes sense if you still taking the medicine to control it, but I just like to identify because I read the report. The report shows there's no tumor in there. Okay, and the third, you do the test about the HbA1c as well. It's about your blood sugar, and the number is in the normal range. So that's also normal.
Okay.
The fourth is about the prolactin and the TSH. There's two hormones related to your pituitary gland. And these two hormones are normal as well. So I believe, just like you say, the issue last year, it should be under control now. But the other thing we need to concern is, although the pituitary gland condition is under control and the hormone concentration is normal, In addition to all of this, how do you feel about your physical or mental condition now?
I always feel very tired
You're
and
tired, right?
always have headaches,
Mhm.
like a
Okay.
strong headaches.
Mm.
And I also noticed that I gained so much weight ever since they diagnosed that. So I don't know what is going on.
Okay. Um, so just like you say, although you control the pituitary gland tumor and the imbalanced concentration of the hormones, but you still have a little bit the abnormal feeling you can feel by yourself, right?
Yeah, but beside headaches and tired, that's the most that kills me most of the days.
Okay. So you feel headache every day, right?
I would say every other day, but not
Okay.
every day.
Okay. I was wondering, what kind of the work you do now?
Oh, I just stay home for mom.
Oh, it's very good. Okay. So actually, you have no work right now, right?
No.
Okay, good. Um, hold on. Let me take a note. Uh, let's talk about the exercise. What kind of exercise you do regularly? Do you exercise
Just
regularly?
walk.
Just walk, buy
Yeah.
something, shopping like that?
Yeah, sometimes take the kids to walk around the mall or the
Okay.
backyard.
Uh,
Yeah, that's about it.
okay. So actually, you might think, uh, actually you have no regular exercise.
No.
So yeah, okay. So yeah. So I think let's relate it to your body weight increase. And Tina also gave me some information from you before this course. You also mentioned that you have a problem like the low extremity pain, right?
Yes.
Okay, can you identify what part of your low extremity?
It's like right here.
Actually, I cannot see what part.
Oh, this
Okay.
part.
No. I mean your low extremity, your leg.
Oh, my legs.
Yeah, sorry. Yeah, your leg.
It's like more like angle part right here.
Okay.
This area.
Uh-huh. Okay. So bilateral side,
The right side.
just only right side.
Yeah.
Okay. Do you have any sports injury history or any any lesion history about that?
No.
No. So it's just you don't know why it just happened.
Yeah, it's just suddenly like a month ago, it started to hurt. So when I walk, it's like I have to limp a little bit.
So did you do anything for it? I
No, I
mean, any
don't run.
treatment or any protection or any treatment for that?
Nothing.
Okay. So now when or how can make it happen?
When?
How long?
I think a month ago.
No. I mean, in your daily life, it's always keep you can feel your ankle pain, or is there any special movement or posture
When I
that
lay down or when I'm sitting too long, I stand up, that's when it hurts. And when I walk. So when I walk a little bit more, the pain goes away.
okay. So do you always sit for a long time in your daily life?
No.
No. So actually, you maybe you do not take exercise regularly, but you still maybe take a short distance walk, or maybe I mean do some activity with your kids like that.
I don't remember, but most of the time I'm cleaning up the house, clean up the mess after the kids.
Okay, good. So let's talk about your sleep problem. How about your sleep?
Bad.
Can you identify precisely?
It takes me a long time to fall asleep. And when I sleep, I'm only able to sleep like for 3 to 5 hours, and then I wake up and I can't fall back asleep.
Okay. So So there's a phenomenon that no matter first time or you wake up at midnight and like to fall asleep again, about the fall asleep is so hard for you, right?
Yes.
Okay, but after you fall asleep, how about the quality of the sleep?
It's bad. I always either sweat or I get a lot of nightmares.
Oh, wait, you got a sweat at the midnight?
Yeah, I've been sweating lately. It didn't happen before.
Mm-hmm.
Yeah, ever
Okay.
since I feel like I gained so much weight,
Uh-huh.
and then when I sleep, I will sweat.
Okay. So, do you always think so much? I mean, do you think many things every day? There are many things in your brain.
Yes.
Oh, okay. Yeah, that makes sense. Okay. I think you have a lot of sweat at the midnight. I think this thing there's a relationship between a lot of sweat at the midnight and the think too much. I mean, in the TCM theory, in the TCM pathological theory, there is a relationship between these two.
Okay.
And so when you wake up in the morning, do you still feel tired?
Sometimes I will
Okay.
when I don't get enough rest.
Mhm. So actually, when you wake up in the morning, maybe you feel a little bit better. You don't really feel so tired, but maybe 3 or 4 hours. I mean, after 3 or 4 hours, you start to feel very tired,
Tired.
right?
Yeah.
Okay.
And sometimes when I can't go sleep, I have to take melatonin
Okay.
to fall asleep.
Is that useful for you?
Sometimes if effective, it doesn't help.
Okay.
Or I take NyQuil.
Oh, okay. Okay. So that's about your sleep. Another thing I concern is your just like the information you offer, the neck bump. Can you talk about that precisely?
I don't know when or how that I got it, but I noticed maybe with my first child, I was breastfeeding a lot. So I guess constantly when my posture was just looking down, and that's how my neck bump started to show more.
So the bump happened on your, I mean, on your back, right?
Yes,
Okay.
right here.
That's like people say the how to say that in English? The Dowager's hump, like that. We say that in Chinese, 富贵包, just like because most of the time people use the cell phone for a long time. So yeah, so the lower part of the cervical spine and the upper part of the thoracic spine will misalignment and make the muscle or tendon around there become tight. So the inflammation condition just keep there for a long time and make the muscle or the soft tissue become thicker. So is that part makes you feel hurt or sore now?
Sore.
Sore, okay. So do you also use the cell phone for a long time? Just always look at your phone?
No, yes. Not
No or
every
yes?
day. Oh, not all the time when the
Okay.
kids go sleep, but
Okay.
when I have my me time.
Okay, so that also means because you have better quality of sleep or maybe better quantity of the sleep. So actually, you use your phone for a long time at night, right?
Yes.
Yeah, and you have no suitable exercise regularly. So I think it's not only the neck bump. I think maybe your musculoskeletal system. You need to do some adjustment for that.
Okay.
Yeah, and okay, you also mentioned the lower back ache. I think that's the same thing. And how about the dizzy? You also mentioned that.
Dizzy only have it when I have my headaches. So I'll
Oh,
get
okay.
dizzy.
So the dizzy accompany with your headache, right?
Headaches, yeah.
Okay. Is there any possibility can cause you cause your headache when you ask your family doctor? Did you ask a listing for your family doctor?
Yes, I did ask, and then they told me it could be my TMJ problem.
Mm? Okay.
So they told me that maybe I grind my teeth at nighttime, so the tensions goes to my head.
Mm-hmm. Yeah. Sometimes this principle makes sense, but sometimes not. So do you also have some TMJ problem?
I went to the dentist last week. They can't find real anything about my
Yeah.
TMJ, but then they told me I've looked two doctors, two dentists. So two dentists told me possibility I grind my teeth at night.
Oh, okay. So did they suggest you put the
Night guard.
mouthbrush, the toothbrush on when you fall asleep?
Yes.
Okay. So do you do that?
Yes, I have it at night, but I feel like the more I wear it at night when I go sleep, it hurts more. When I don't wear it, I feel like
Yeah.
my headaches is not that bad.
Okay. So actually, before and after you take it, this seems no really obviously change, right?
Yeah.
Okay. Okay. Let's go back to talk about your I mean personality or your habit. You just mentioned you always think too much. Do you like to talk about this more? Why you always think too much? And I mean, I mean, you don't need go to work recently. So suppose maybe there's no really a lot of stress around you. So do you like to talk about this precisely?
Yeah, well, I think about more about my kids. Like he started to go school this year.
Mm-hmm.
So I just think like, will he be, he's used to going to school. I'm
Yeah.
just afraid he will get sick. He's not eating
Mm-hmm.
because he recently got sick.
Okay. So
So
how many kids you have?
I have two.
Okay, good. So in addition to kids things, is there any other things can make you feel stressful or nervous or yeah?
Mm, yeah, about my cousins.
Okay. So there's a lot of things you need to pay attention or focus and maybe just always think about this. So that means actually you use a lot of energy, no matter mental or physical energy, to deal with all the things, right?
Yes.
Okay. So let's talk about your GI function, okay? How about your appetite?
Ooh, a big appetite.
A big appetite, big appetite, but no exercise, right? Oh, that's too bad, I think. Okay. Okay, so big appetite. So how about your poops and pee?
Normal.
Okay, do you have poop every day?
Yes.
Okay, how many times?
Sometimes twice, sometimes just one time.
Okay. So about the poop time, is almost like the same every day.
Yeah.
Okay. Is it a stool form shape?
Yes.
Okay, good. So how about your pee? Also good?
Sometimes yellowish, sometimes normal.
The yellow you just mentioned, you mean the color, because the normal color of urine is the light yellow. So you mentioned the yellow, do you mean it's more dark yellow than the normal light yellow?
Sometimes, yes, not like dark, but it's like neon.
Okay. And is there any abnormal smell?
No,
Okay, good. So do you need pee at midnight?
no.
No? Okay, good. And in addition to you think you think too much, or you should think many things. do you also get nervous easily?
Yes.
Okay. Is the nervous makes you feel unwell around your stomach or any other part of your body?
I don't know.
Okay. So you don't remember the thing like this happened, right? Before.
Yeah, no, I don't remember.
Okay. So recently, do you find your focus or your memory seems to become worse than before?
I just noticed that my memory is bad.
Okay.
Like, I can't
Always.
remember like what I ate yesterday or
Yeah.
where did I put my stuff. Like
Okay.
short
So
memory loss.
just recently, or it's a long story? I mean, a long
Recently.
history. Recently. Okay.
Yes.
Okay. So let me check. Is there anything I need to know? Oh yeah. How about your period? Can you talk about that?
Abnormal. But ever since I took the medicine,
Mm-hmm.
it's been back to normal.
Mm-hmm. Okay.
But it was abnormal before.
So so far it's regular, right?
Yeah, except for this month.
Mm-hmm. Okay. So how about the blood? I mean the color of the blood in the period?
It's dark.
Dark.
Yeah,
With the clot? Blood
with
clot?
clot.
With
A
clot.
lot.
A lot?
Mhm.
Okay. And do you also feel abdominal pain in the period?
Sometimes.
Sometimes. Not every time.
No.
Okay.
But I noticed that if after gave birth, I don't
Mm-hmm.
feel as much as before.
Mm-hmm.
The stomach pain.
Okay. So how many days in your period?
3 days.
3
Sometimes
days?
4.
3 to 4? Only 3 to 4?
Yeah.
I
Yeah.
mean, from the beginning to the
end.
totally end, just only
Yes.
3 or... Oh, okay.
Ever since
So,
taking this medicine only for 3 to 4 days. But before the medicine will last me 7 days.
oh, okay. The medicine you mentioned is the hormone control medicine?
Yes.
Okay. So that means in the past 1 year, your period decreased to 3 to 4 days.
4 days
than
max.
before, right? Okay. Do you also have a low back pain?
Yes. When my period. On my period.
Mm-hmm. Just only in period?
Most
How
of the time.
about most of the time,
Yes.
right? Not only in period, right?
Yes.
Okay. Okay. So okay. Also, let me manage this information. So at the same time, I would like to ask Tina, can you take a pause for us?
Okay.
Thank you.
She can put it over here, so she can put her arm on the.
So then later.
No, it's okay. You can just put your arm here. Let me go to this side. Okay, pulse taking. Should start with that side first, but let's start with the left. Dr. Lin commented last time that I pushed too hard when I first.
Sorry.
Yeah. So when you guys take the pulse, first just lay your fingers there.
Okay.
Thyroid process. Dr. Lin, for your
Yes.
pulse taking, is your tune position right where the styloid process is or in front?
Mm-hmm. Okay.
Can I have a earbud? I can't hear what you're saying. Oh. Hello, Dr. Lin?
Yes.
Okay, so when you're taking pulse,
Mm-hmm.
is the tune position distal to the styloid process or for your style?
When I take a pause, I will use the 3 fingers together. Then I will push it slowly, gently from superficial to middle to deep. And then I will release my finger and feel the reflection from the pulse and make sure the energy, the qi is enough or not, and make sure is the qi stagnation or not. Then you should be careful to feel the pulse. The thing in the blood, the liquid, the flow in the vessel, and make sure the quantity of the blood is enough or not.
Okay, but in terms of position, Chun, where do you identify where Chun is in your pulse taking technique?
You mean left side or right side?
At both sides, 寸关尺.
Okay.
The way.
Okay. Yeah. My pulse taking way is depend on the Nanjing. So the left side, Chun is for heart or small intestine. Yeah. And the right side is for lung or big, large intestine. Yeah.
Okay. 那这个寸啊，它是在这个 styloid process 的前面，还是直接中间这样子过去？就是再把
actually
再上去一点。
等一下，let me check the screen. Okay. Actually, we put our index on the chun. Is the location is before the styloid process.
Okay, so it's the same as what we learned in school. So
styloid
process first.
Yeah, I think the location you take a pulse is the same all over the world. Most of the time, it's the same in just like the textbook say.
Okay.
Yeah.
So if I put my fingers on her pulse slightly, just with no pressure, I can feel the guan. Not the chun or the chi. Pushing down a little deeper on the chun, it feels forceful and slippery. Guan is wiry and forceful. And chi, deep, thick, and forceful. But most prominent pulse is the guan. It's very strong. Okay, then let's do this hand.
Tina, you say forceful, that's 紧, right?
No, 红就是有力。
Oh, 红 okay.
Can you take the bracelets off? Thank you.
Sorry.
No, it's okay. You need help? Okay. So light pressure, nothing on the superficial level. Chun is slippery, fast, and forceful. I don't know if because she's nervous. The guan is thick, wiry, forceful. And the chi is deep, thick, and forceful. So Dr. Lin, overall, it just feels pretty strong in all positions.
Okay, I have a quick question for Diana. Before you come to here today, what breakfast you eat?
Oatmeal.
Oatmeal?
Egg. And the bread, mantao.
Mantou. Okay.
And coffee.
Also, in addition to all milk, you also drink coffee, right?
Yeah, I have to have coffee.
Okay. So actually, when you finish your breakfast today?
When? Like 7:30.
7:30, 7:30. And then now I think is in West Coast now is 9:30, 9:30, right? So it's about 2 hours. Okay, one quick question. Do you always drink a lot of water or liquid in your daily life?
A lot of coffee, water,
Okay.
and coconut water.
Okay, so that's bingo. So
Hey,
you have
Dr. Lin,
so
why you
so
ask this question? I'm so curious.
yeah.
Why ask a lot of water?
Oh, okay. Because all the symptom Diana mentioned is, I think there's no connection can make between the pulse and the symptom she mentioned, because the symptom she mentioned, all of the symptom has a trend to the weakness, to the vacuity. But the pulse shows, just like Tina said, okay, the pulse seems very strong, very forceful, very powerful. So there's a gap between the symptom and the pulse. So it's a very common condition in the clinical experience. So the healthcare provider must think about this deeply to identify what is really happened between patient's body and the phenomenon patient shows. And most of the time, the pulse show like this in the morning, always because patient maybe patient eat a lot of breakfast, or you check the patient just before patient finish the breakfast, or maybe patient drink a lot of liquid, any kind of liquid. So the pulse can show, the different phenomenon. You cannot just directly related to the symptom. Okay.
So drinking any kind of liquid will make the pulse stronger?
Especially in the guan, I mean in the GI, in the middle jaw, you can feel the power of the pulse can become stronger. And also, if patient the liquid patient drink is coffee or maybe tea or any other stimulator, it can make all the three-part pulse become stronger. But it's not really pulse belong to the patient, just because of the patient's diet or any other factor. So that's a point we needed to pay attention. When you take a pulse, you cannot just depend on the pulse shows. So that's why we have 4 examination in TCM system. The different diagnosis way, the different information collecting way, is for collecting different style of the information. So not only just depend on your patient's pulse, you need to inspection or inquiring and palpation.
Can I ask a real quick question, since we're
Yes,
on this topic?
Sure.
So, Dr. Lin, is this just breakfast or any time after a meal, like lunch or dinner, or any time when you drink, the digestive, the guan pulses will be stronger?
Yeah, I think that's possible. Yes.
Okay, so not just breakfast.
Yeah, so that's why if you ask patient, you inquire patient and make a note for all the symptom. Actually, after the inquiring way, you can collect some information. But after you do the palpation, I mean the pulse taking, you can collect another style of the information from patient. And the important thing is we needed to connect these two part of information, because if this two part information is similar, that's very simple, right? You can just very easy for you to connect these things and connect to the pathological knowledge you know, and do the right diagnosis and make a good prescription or acupuncture. But if you find the post-taking, the result of post-taking is different or even opposite to all the symptoms patient announce, then that's the examination. There's really a test for healthcare providers.
So
you need
she
to
said-
identify the things.
She said she had breakfast at 7:30. So even after 2 hours, Guan is still strong.
Actually, it depends on patient's condition, patient's physical condition. For example, if Diana drink a lot of coffee, even after 2 hours, you can check her Guan part still superficial or
Okay.
still powerful. And another thing is also depend on patient's GI function. If a patient is not really drink a lot of water, liquid, coffee, or is not really eat too much, but the patient's GI function is not really good. So that also means patient's bowel movement, patient's GI function is not good enough to digest all the things in time or on time. So even after 2 hours, you still can check the Guan part still superficial and powerful.
Okay, thank you.
Yeah. good
Okay,
point.
so let's go on next.
Okay, so Diana, I would like to ask you, can you show your tongue for us? I'd like to check your tongue.
Okay, hold on. We're gonna zoom in.
Okay.
Wait, one more time.
She got it blocking, so we'll let her take a picture first.
Okay.
And then can you put your tongue up again?
Grace, okay. Can you
Okay, actually, we can see Diana's tongue, the coating. About the tongue phenomenon. There are some phenomena we can pay attention at the same time. First one, the color. Okay, Diana, thank you. That's it. Yeah, thank you so much. First one, we need to make sure the tongue. Sorry, I said that again. First one, we need to make sure the tongue shape, the size. Okay. The second one, the color. The third, the coating. The coating including the color and is less thin or thick or greasy. That also can tell us what kind of the condition in patient's GI function. So we can see before we discuss this further, please, Diana, can you show your eyes like this? Yes, I like to see the color. Okay, can you put this down more? Oh, okay. Yeah, I think everybody can see the color, the lower part of the eyes. The color is a little bit light. I mean, it's too light if you compare with a normal condition. So,
No, Dr. Lin.
Yeah.
It's actually not too light because we have fluorescent lighting here. What is it? What do you
okay.
think, Grace? I think it looks fairly red.
oh, really?
I think because of the fluorescent lighting, you cannot really get it very well. And
Yes.
also the tongue. Can you stick your tongue out again? Okay. What do you see, Dr. Lin? What we see here is I see a lot of red dots on the tongue. Do you see that as well?
I can see the red dot, but that's because maybe Diana's eat some spicy thing or some heavy flavor thing. But you can see the whole tongue. I mean, the color of the whole tongue is light.
Okay. How about you, Donna, Grace? Do you guys think it's light?
It's not light. It's red with the greasy tongue.
Donna, see here.
But I don't eat spicy.
No, it doesn't matter what
Okay.
you eat.
Can you check your line on your phone?
Picture.
Grace took some pictures. It's more accurate. Well. So Grace, what do you think?
I think a little bit red and a little light purple.
Yeah, this fluorescent lighting maybe distorts the tongue color a bit for you guys.
Yeah.
Okay, I send the picture and then if I can see easily.
他们看不到，这是外国人，他没有在 line 里面。这些老师可以把它 follow。Oh, Dr. Lin,
Yes.
send the picture to you in line. Can you?
Okay.
Are you able to post it on?
Okay, let me check.
Yeah, that's one difficulty with telemedicine is that the tongue color never comes out correctly. It's a little bit hard.
So does my tongue indicate I'm unhealthy?
No, it gives
One more time.
it reveals what health
Okay.
how your health
Put your
condition
tongue out,
is. So
Yeah,
it's-
I think it's different. It's really different. If I check the picture and what I see in the screen, yeah, it's really different.
Yeah, sometimes the monitor calibration on each of our computers are all different too.
Yeah.
So from what we see, let's go with Donna's finding. Donna's youngest. Her eyes probably the best. So what do you see? Red and red dots?
It's yes, I see a red tongue, and it's the tongue itself is very moist,
Okay.
and it has a slight yellow coating too. But that could be from
Coffee.
Yeah. Yeah.
Any teeth marks?
no teeth marks. One more time, no teeth marks.
Okay. So if Dana's tongue just like the picture shows, I think okay, I would like to change my saying. First one, I think the color is still okay, but the coating just like you say, it's a little bit yellow, but I think it's because of the drink the coffee. And there are really some red spot on the tongue, but still okay. And if it's just like Diana say, it's not you didn't eat spicy thing. I think the red spot still like we say the heart fire, 心火 heart fire, but that is not because of the spicy food, but because of a bad quality of sleep.
Oh.
Yeah. You know what?
I have to do with fried food?
No. I would like to explain this more about the red spot on people's tongue. We always think about is a fire.
Mm-hmm.
But where is the fire? We need to depend on the red spot shows which part of your tongue, okay? And according to the picture, the red spot shows on the tip of your tongue, and there are still a little bit in the middle part. So about the part identification system, we will say the fire, the heat, appear in the lung and the heart system. And I think it's also because your bad quality and the quantity of sleep.
Mm-hmm.
And when you have not enough sleep, your body will compensate. I mean, you have not enough rest, but you still wake up in the morning and do a lot of things, but your physical and mental still really tired. But they need to support you. Your brain, your body still support you to do anything you needed to do every day. So our body will enter in the compensation condition. If we explain like this, that's the same meaning as we say in traditional term 上火. Yeah. So I think if you do not really eat spicy thing or stimulate things or heavy flavor things, the red spot on your tongue may be caused by the bad quality of sleep.
I have a question. With the heat in my body, would that cause me crankiness?
Actually, I don't think so, because the heat in here is just local, and I think most of the time the heat like this affect your mental more than your physical.
Oh, okay.
Yeah.
Because sometimes I would get mad easily, so I don't know. It's because of the heat.
Oh yeah. If you feel so easy mad, become mad, it's just like you feel
irritated.
nervous. Yeah. Right. That caused because of the heart fire. Hot flash just like I say, you need to take a rest, but you still keep waking because you need you have a lot of things to do. But at that condition, you are in the compensated condition. So your body, your mind try their best to support you in the vacuity system, in the vacuity condition. So it's more easily for you to feel mad or just you just cannot come down. Maybe just a little bit of thing, very tiny thing, can trigger you feel angry.
Right.
Yeah. Okay, so we have taken the pulse and checked the tongue and the eyes. So the last part about the palpation, I would like to ask Tina to palpate and tap Diana's belly and the chest. We like to check the sound and like check the palpation feeling, the texture and the temperature.
Okay. So I wrote down that when we're doing the abdominal palpation, there are 4 T's. So if you guys can write this down too. The 4 T's are texture, temperature, tension, and then finally we're tapping to hear the sound, whether it's hollow or solid inside. So again, the 4 T's: texture, temperature, tension, and tapping. So, Grace, you can go first. So first, Dr. Lin says we check. Can you all see? Okay. So overall, we're looking first at the skin texture, to see if there's any discoloration, and looks like it's okay. There's no veins popping out. There's no different colors. And then next, go ahead, Grace. She'll feel the temperature first from the epigastric area, and then going to the sides, and then to the sides of the belly, and then below the belly, to see if there's any temperature difference. So Dr. Lin also said that when you do this, you want to make sure your hands are warm. So do you feel anything?
Yeah, on the top, both sides is a little bit hot. Okay, and then on bottom, I think this is cold. So 2 sides is hot too.
And how about the stomach area?
Stomach area, yeah, is
Normal? Hot?
on the surface a little bit cold, but on the side is hot.
Okay.
Like hot and cold.
Your turn, Dana. And this way.
Okay. Why is it the palm instead of the back of the hand?
That's a good question. Dr. Lin, Donna asked, why do you use the palm instead of the back of the hand to feel the
I'll do
temperature?
both.
I always use my palm. I don't use the back.
Why?
Because the temperature between palm and the back is different. And we always, that's the first reason. And the second, the texture, the feeling, if you use the palm, it's more tiny. You can feel the tiny difference between different parts. So, I mean, the palm is more sensitive than back, I think.
For me, my palm is cooler than her entire belly.
Your hands.
My
is
hand
cold.
is colder. The only part I feel cooler is here. Everywhere else is all hot.
So,
Yes.
so how about the coffee Diana drink in this morning? Is it cold or hot?
Hot.
Okay.
Does that matter? Does cold coffee make any part cold?
Yeah. Most of the time, make the stomach cold first.
Okay.
Yeah, and if patient drink cold thing a lot day by day, the cold feeling will from the stomach to the intestine.
Okay.
And when you tap in, you can feel the broad stagnation sound as well.
You said you drink a lot of Coke?
Cold.
Cold drink.
Oh, you drink a lot of cold?
Cold drinks.
Oh
Yeah,
my
she
God.
does.
Okay.
Oh my God. By the
Only
way,
coffee is
everybody,
hot.
Only
in the
coffee is
last
hot.
class,
Okay.
Dr. Lin says he never ever eats anything that's colder than his own body temperature.
Oh,
So that means he heats up his fruits too.
Yeah, for
I think
sure.
we should do that too, starting tomorrow.
Yeah.
Seriously.
Yeah, I'm seriously. Yes.
Yeah, Dr. Cheng also, he microwaves his fruits.
Yeah.
In case you didn't know, Dr. Jimmy Cheng. So not weird. Weird only to you, Diana. Okay, so next let's go into do the palpation. Okay, Grace, you go first. So with palpation, we're feeling tension. If there's any particular part that is harder than others. So first, again, is the epigastric area, right? And then next, Dr. Lin tells us to feel under the ribs on the hypochondriacs.
But
So
this
that will
side- this
show
side-
if there's liver qi stagnation.
Grace, if you use your finger, push Diana's stomach deeply, does Diana feel pain?
Do you feel pain when she's pushing?
The left
No.
side? No. How about
No,
right?
no, no. I mean,
Right
you just put the middle line of the stomach.
Okay, here.
no.
No
No.
pain.
No? Okay, good.
Pain here.
And the
Right
right
there.
side, I can touch
Right
it's
there.
something there, like it's very hard. I can feel it. That
Right there.
this size, like how much? Like this size. I can feel the edge of the
This size, this
Yeah,
big, like a
yeah.
golf ball.
yeah.
How about left side?
And that
Big-
How about left side under the cage?
left
Under the
side
rib
is
cage.
nothing, and no feeling, right?
No feeling.
And right side, when I touch deeper,
Yeah.
how did you feel?
Pain.
Pain. If pain scale 1 to 10, how much?
It's not,
How about here?
not much.
Not much. 3 or
It's very discomfort.
or discomfort only?
Yeah, but a little bit pain when you push it more.
Okay, I can feel something is there. It's like tennis ball, like this size.
Tennis ball size.
I can feel the edge. See, if you can see from the camera, I can feel the edge here.
Right there is the most pain.
Oh, here.
So Diana, do you have any test for your liver? I mean, the liver or gallbladder, like this letter area?
I don't think so.
Okay, so how about the blood test?
I have the blood test, but I think this year I did a physical test.
Okay, how about last year?
Yes, but they didn't say anything wrong.
Okay, good.
Okay, and then the two sides.
Okay, let's see the right side. A little bit tense, but not too much. Any feeling?
Right there.
You feel?
Yes.
How did you feel?
Pain.
Pain?
And what do you feel?
Pain.
Grace, what do you feel?
When I touch on the top, it's soft. But if you go inside,
Right, it's pain.
half inch, and you feel something.
What do you feel? Like a ball?
No,
Something hard?
no, just a little bit tense, not tight.
Okay, tightness.
Yeah, tightness. How about here? No, nothing. Here is like soft.
So does below the belly feel soft and hollow? Yes.
Can you push the left side just opposite another side? Diana mentioned pain.
How about here?
No, little bit.
Yeah,
Can you push more deeper?
Pain.
pain.
Yeah, that makes sense.
Why?
Okay.
腹股沟啊.
No, the
Yeah. How about that? If you draw a line from umbilical to the ASIS and push the outside 1/3 part, the point outside 1/3. Is there hurt?
Soreness.
yes,
Soreness?
soreness.
More inner? How about more inner?
Yes.
Pain?
Pain.
Pain.
Okay, good.
So what is this, Dr. Lin?
Blood, how can I say that? Blood stagnasis? 血瘀?
血瘀 blood stagnation?
Yeah.
This
And blood stagnation of any specific organ or anything?
No. The 血瘀 because of Diana drink the codeine for a long time. It's very easy, can be seen in the clinical experience, especially happen in women. So if you check the book from Japanese traditional medicine, there are some books talk about this. The 血瘀 is more easily happen in the lower part of abdomen, especially the cold factor affect our blood circulation. So yeah, please decrease or avoid the cold things into your mouth.
So drinking too much cold stuff is not good?
Yeah, absolutely.
No good.
No good.
Dr. Lin, by the way, she's the daughter of our last patient with the water problem, remember?
Mm-hmm.
You know, the one with the cough, and she has 真武汤 syndrome with water everywhere.
Yeah.
Belly is full of water. You might be like your mom
Oh no.
if you keep drinking the cold water or
Mm-hmm.
cold drinks.
Yes.
I eat food
Okay,
cold
what do you
too.
feel, Dana?
It's the same as Grace.
Okay, so we have one big tennis ball mass here on the below the right hypochondriac area, and then
So after the palpation, can you also tap the abdomen and sound? Yeah.
yeah. So
We
next
need
we
to
finish
we
the
need to check it.
checkup,
We need to
right?
make sure the sound.
And then the next we're checking the sound. Go ahead. This one we're just gonna tell you what we feel. Because what we hear, because the microphone is not picking up the sound. Yeah, tap 这样。
Oh, this is like.
有。它 zoom will cut out the. Right here is more hollow.
Mm-hmm.
Ready.
Okay.
还好 seems all pretty solid. 从这边 it's all the same sound. Oh, here sounds like water.
Yeah.
Water.
So is that what?
Not as bad. This whole section here is all water. It's to the side. Solid. It's all solid too.
How about the area we say is
It's solid.
solid?
You know where there's a
denser.
tennis ball?
Mm.
It sounds solid too. Just right here is a little hollow. So here is a little hollow. Here is watery.
Okay.
Here's a little hollow. Here's watery.
Mm-hmm. Okay.
And I burp a lot. Would that
Oh,
make
burp.
anything related?
So you.
Has a video on how to do the abdominal palpation. I'll post a link in the chat room for you guys.
So Diana, you also have a heartburn symptom.
Before I got pregnant, I have the ulcer.
Mm-hmm.
And then after I gave birth, that ulcer went away, but I always have a lot of burps. Like I
Oh,
have a
okay.
lot of gas.
Okay, but not a reflex, right?
Yes, I did before. Not now.
Okay. Okay.
So is my fat water weight?
The patient is asking if her fat is water weight.
Okay.
So I'm swollen?
So okay. So I think before we end the first part, I'd like to give Diana some health education.
Okay.
Okay. First one, I think Diana, you need to decrease the liquid intake. Okay.
Increase liquid intake?
Decrease. Yeah. Decrease the liquid intake. The liquid.
water?
The liquid
Too much
not
water or
only
coffee or whatever, anything.
Yeah.
Any drink.
Oh,
the liquid is not only water, but coffee, tea, fruit, or any food watery. You need to pay attention, decrease the amount of these things intake. But you will meet one question: how much water I need every day, right?
right.
Every people hear this information, decrease your water intake, then they will ask you this question. So You know, in the TCM system, we like make life balanced. So less water intake is not good. More water intake is not good as well. So you need to make sure what are the feeling you really feel. I mean, if you really feel thirsty, you need water, please go ahead. Drink enough water, drop by drop, okay? But if that's just a habit, you just like pick up a cup and just drink the liquid, that's not good for you, okay? Yeah, so another thing is you just say you like coffee, you drink a lot of coffee every day, and you also drink a lot of cold liquid.
Yeah.
So I think because you feel tired, so maybe the coffee can help you keep alert. But it's just like a bad circle. You have no good quality of sleep, so you feel tired at the daytime. Then you drink a lot of coffee to support this. Then you still have a bad quality of sleep. So that's a bad circle.
Oh.
Yeah. So I think you need to break from a point. No matter the point is where, you need to break out the bad circle. So I suggest you can begin from your adjust your GI function. So the GI function has the closest relationship of your diet. So be careful, try your best, don't drink or eat low temperature thing, and decrease the value of the coffee you drink. This is the first one. And the second one, I think you really need take the exercise regularly, because you drink a lot of coffee, but your metabolism rate is low. So the damp, the humidity concentration will accumulate in your body. That also makes your muscle skeletal system become heavy, sore, and pain. So your low back pain, your low back sore, or you feel your body weight gain, and your leg hurts. I think the damp is a possibility of the reasons. So take exercise regularly. Do more cardio do more exercise can increase your cardiopulmonary function. Before that, warm up, move your joint, stretch your muscle group. Then you do the exercise regularly, day by day, from less to heavy. And at the same time, don't drink or eat cold thing. Decrease the water intake you don't really need. Then I think the whole condition will become better. Okay. And I will think about the prescription I can give you after this section, because there are many issues I needed to think about this. For example, the blood circulation, or the bad blood circulation in your lower belly, that affect your pelvic blood circulation, and also affect your lower extremity blood circulation as well.
Okay.
Yeah, and there's another thing about your liver area, because by the palpation and tapping, there seems a little bit issue around there. I will think about this. And that will also affect your quality of sleep, makes you cannot fall asleep easily, because the liver blood circulation is not really good. I mean, in our traditional concept, the liver blood, if the liver blood circulation is not good, or the liver blood deficiency, that can make your quality of sleep bad. So I also like to do some adjustment for you about that. And about your muscle pain on no matter where, from neck to your lower back to your legs, I think in addition to exercise I just told you, but also don't just sit for a long time, And if you do your work, your daily life, you take care of your family member or do some home job in your house, don't just do it for a long time. You need to take a break. Maybe every 1 hour, you need to take a break, do some stretch, take a rest, then go back to do that.
Okay.
Yeah. And so we back to the original problem about your pituitary gland tumor problem. I don't think right now you really need to worry. Just focus on your pituitary gland problem, because under the medicine control from Western medical system, from your doctors, I think right now you can depend on the follow-up, the test result to make sure what really happened, what really undergoing right now. But just like TCM theory says, every phenomenon, every life expressed depends on the whole body condition. So for sure, of course, before 1 year ago, you have an issue around your brain, your pituitary gland. But this one is the same, also depend on your whole body condition. So just like we say, your energy, your blood, your spirit must balance, keep all the things enough, and keep all the things can flow very smoothly. So if you can keep the condition like this, you can keep your physiological function good. So about your pituitary gland problem, I think you don't really need to do anything about it right now.
Okay.
Yeah, you just focus on other things. So if your whole body condition become better, for example, your headache become better, your muscle pain become better, your quality of sleep become better, I'm sure it will also become better around your brain.
Got it.
Okay. Okay, so I think that's it. If I have any new idea, I will tell Tina and let Tina tell you about this. Okay.
Okay, so let's take a 10 minutes break.
Yeah.
Dr. Lin is going to come up with the formula for the patient. And then the next hour, we're going to talk about the formula and talk about the etiology of the patient and answer some questions. Okay?
Okay.
Come back
Thank
at
you. Okay. Thank you.
10:25.
Recording stopped.